With operative treatment comes complication as well. And with Hallux valgus, sometimes the complications may be more marked than with the non-operative treatment as well. What we need to know is what we need to counsel patient about certain complications which are more common, especially with the Hallux valgus surgery. This complication, the first and foremost, includes the recurrence of the deformity. That despite the correction of all the angles and at least the gait mechanisms, now there has been actually research which is going on, because this is not an isolated problem the first ray. There is problem with the forefoot, midfoot, as well as the hindfoot as well, because the gastrosoleus hyperactivity is also seen, and this leads to gait abnormalities, that there is some problem which is actually the kinematics, gait kinematics are disturbed. So there is always a chance that this muscle imbalance which is actually occurring, this may reproduce a deformity despite adequate correction at the time of the surgery. One cause of recurrence could be actually the undercorrection, but which usually results in early recurrence, but despite the adequate correction by the surgery, this may result in a recurrence of the deformity. The next is, it could be complication is infection. As you know, we have to nowadays, there's actually a tendency towards minimally invasive surgery with minimal incisions that produce less chances of infection, but sometimes we have to go for open procedure, and as by the current research, there is no exact evidence which is available which states that minimal invasive surgery actually gives more benefit in terms of open surgery. But with a large incision, there is always increased chance of having an infection, and with infection, sometimes may eventually require extra procedures, or multiple operations may be required as well. And sometimes even the situation is so wrong that we have to go for certain arthrodesis of the certain joints, because of the infection is actually creating non-union over there. Then is the ulceration. As you know, there are multiple callosities which are formed over the metatarsal head, which is usually seen on the medial as well as the plantar aspect of the foot, and these callosities may ulcerate, eventually leading to ulcer formation under the foot as well. Because sometimes we have to give post-operatively, we have to give cast, especially if the arthrodesis has been done. For example, if we have performed the Lapidus procedure on the patient, we may have to give cast and keep the patient non-weight bearing for 6 to 8 weeks. There is always a chance that one of the callosities which may get pressed under the cast and lead to ulcer formation. Then is the metatarsalgia. This is associated with the Hallux valgus, as well as sometimes despite the correction of the all the angles and actually the Hallux valgus deformity, still as the second metatarsal is the length of the second metatarsal is more than the first metatarsal, therefore the main weight bearing axis of the body is such that it goes through the second metatarsal, and this leads to actually the pain in the other metatarsal, leading to transverse metatarsalgia as well as the metatarsal stress fracture. And the most commonly the metatarsal stress fractures which occur is in the second metatarsal. And why this happens? Because the problem is the weight bearing axis has been shifted from first metatarsal to the second metatarsal, is actually and leading to metatarsal stress fractures, because second metatarsal is not made to bear the weight, but it's not as thick and it's not as strong as the first metatarsal. But due to osteotomy, the length of the metatarsal has reduced, and actually the second ray is longer than the first ray. Therefore, the second ray is actually bearing the most of the weight of the body, and the weight is more transferred to the second ray. Then this may be associated with the Hallux valgus, or it may be associated with any surgery actually. And since certain patients have increased tendency to development of this CPRS, called as complex regional pain syndrome, which may be associated with increased pain, associated with redness, swelling, and sometimes increased stiffness as well. And this itself requires certain evaluation and treatment as well, along with the certain different type of therapy. But you need to tell the patient regarding all these complications, of which the most importantly it is the recurrence of the deformity and metatarsalgia and stress fractures, because nowadays the research has shown that despite adequate correction of surgical correction of Hallux valgus, the gait kinematics remain still disturbed, and this may lead to actually the complication, and complication in certain articles may be as high as 25 to 30%, which means in every 1/3 surgery actually gets complicated. Therefore, you need to consult the patient regarding problems as well as the pros and cons of the surgical and non-surgical management of the Hallux valgus. For more videos, either go to www.sqadia.com, or you can go to and download the sqadia.com application and watch all the videos related to orthopedics and even all other subjects, whether clinical or basic sciences, on this application. Thank you very much for watching. Keep watching sqadia.com.